So picture this. You're buried under a massive mountain of blankets. Your teeth are just chattering away and you're shivering violently. You feel absolutely freezing cold. But then someone touches your forehead and tells you, whoa, you are burning up. It's honestly one of the most relatable, universal paradoxes of human biology, right? Like, why on earth does your body make you feel like you're freezing when your internal temperature is actually spiking? Well, the answer involves this incredibly sophisticated biological defense mechanism happening right inside your brain.
Welcome to Clinical Capsule, your trusted guide for clear and concise medical learning.
Welcome to this explainer on the science of fevers. Today, we're going to dive into the complex, microscopic cascade of events that literally transforms your body into a hostile environment for invaders. As we unpack the biology here, it becomes beautifully clear that a fever isn't just some annoying symptom. It's actually a highly active, calculated defense strategy. Here is our quick roadmap for today. Number 1, the body's thermostat. Number 2, fever versus hyperthermia. 3, the anatomy of a fever. 4, to treat or not treat. And 5, rashes and rare exceptions. Okay, starting with section 1, the body's thermostat. Let's understand the baseline. Think of this tiny region in your brain called the hypothalamus as basically a highly sophisticated HVA system for your body. It's constantly working behind the scenes, balancing the excess heat produced by your muscles and liver with the heat you're losing from your skin and lungs. Now, when we look at the strict scientific baseline, 37.2 degrees Celsius, or 98.9 degrees Fahrenheit, is defined as the maximum normal oral temperature at 6 a.m. for healthy adults. But here's the thing, our bodies actually have this daily rhythm, a circadian variation. So temperatures are naturally lower in the early morning, and then they rise to a maximum of about 37.7 degrees Celsius, or 99.9 Fahrenheit, usually around 4 to 6 p.m. Basically, anything exceeding that normal daily variation is what we officially classify as a fever. But there's a crucial detail here. How you actually measure that baseline really matters. Oral readings can sometimes be artificially lower if a patient is breathing through their mouth, which, let's face it, happens a lot when you have a respiratory infection. Ear thermometers or tympanic readings in their unadjusted mode can read even lower than that. On the flip side, rectal temperatures generally sit about 0.4 degrees Celsius, or roughly 0.7 degrees Fahrenheit, higher than oral readings. So maintaining consistency in exactly how we measure is absolutely key to tracking a fever accurately. Moving right along to section 2, fever versus hyperthermia, when the thermostat hacks. So what exactly is the difference between your internal thermostat being intentionally raised and just experiencing a dangerous environmental overheating? Well, a fever is a deliberate resetting of your hypothalamic set point. It's triggered by these specific molecules called pyrogens. And because it's completely controlled by your body, it actually responds to antipyretic medications, things like Tylenol or Advil. Hyperthermia, on the other hand, is a completely different and often very dangerous scenario. It is an uncontrolled increase in body temperature that basically outpaces your body's ability to lose heat, like if you were working outside in a really hot environment. In hyperthermia, your brain's thermostat setting hasn't changed at all. There are absolutely no pyrogenic molecules involved, and standard fever medications, they will not bring that temperature down. All right, section 3, the anatomy of a fever, the microscopic whodunit. If a fever is an intentional hacking of our thermostat, we have to ask what exactly turns the dial. The spark that starts the whole fire is called an exogenous pyrogen. Now, fun fact, pyrogen literally comes from the Greek word for fire, and exogenous just means it comes from outside the body. These are usually microbial products or toxins. A really classic example would be a staphylococcus infection that starts producing toxins. These invaders enter your system, but they don't actually change your brain's thermostat directly. Instead, they kick off this incredible biological relay race. Let's walk through this step by step. It's pretty wild. First, the exogenous pyrogens enter your body. Second, your body's own immune and endothelial cells react by releasing pyrogenic cytokines. These are just small proteins with catchy names like IL-1, IL-6, and TNF. Third, these cytokines circulate in your blood and they trigger the production of a molecule called PGE2. Interestingly, this PGE2 is produced both in your peripheral tissues, which, by the way, is exactly what causes those awful muscle and joint aches you feel when you're sick, and crucially, it's produced right in your brain. Finally, step 4. It is the elevation of PGE2 right around the hypothalamus that ultimately raises your body's set point. When that PGE2 interacts with receptors on glial cells inside the hypothalamus, it triggers the rapid release of a neurotransmitter called CAMP. And boom, that is the exact moment the switch flips. Your brain essentially says, okay,
Normal is no longer 98.6 degrees. Normal is now 102 degrees. And this, right here, perfectly answers the question we started with. Why do you shiver? It's because your brain suddenly thinks your current temperature is way too low for this brand new setting. So it triggers vasoconstriction, literally pulling blood away from your skin, which makes you feel freezing. And if that's not quite enough to warm up your core, your muscles begin to rapidly contract, which is that violent shivering you experience, all to generate heat until your blood matches the new, higher thermostat setting.
Which brings us to section 4, to treat or not treat. Let's look at the clinical applications. For your common run-of-the-mill viral infections, you might actually be surprised to learn that you don't necessarily have to treat a mild fever. Clinical evidence shows us that taking routine antipyretics does no harm, sure, but it also doesn't actively delay or speed up the resolution of the infection. Sometimes, especially for bacterial infections, doctors might actually prefer to withhold fever reducers initially. Why? Well, because watching the fever can be a brilliant natural indicator. It helps them evaluate if a newly prescribed antibiotic is actually working against the infection. But of course, when we do decide to treat, antipyretics work by inhibiting an enzyme called cyclooxygenase. This essentially blocks the production of that PGE2 molecule we talked about earlier, prompting the thermostat to reset back to normal. However, there is a very, very strict rule when it comes to children. You must use acetaminophen or ibuprofen. You should literally never use aspirin to treat a fever in a child. Doing so significantly increases the risk of Ray's syndrome, which is a rare but incredibly serious condition. Finally, Section 5, Rashes and Rare Exceptions. When a fever is accompanied by a rash, physicians essentially have to become visual detectives. Defining the exact type of skin lesion is absolutely critical for the diagnosis. For instance, are the spots macules, which are just flat areas of changed color, or are they papules, which are small, raised, solid lesions that are under 5 millimeters in diameter? Getting that precise appearance, combined with the context of the fever, acts like a unique fingerprint. It helps doctors diagnose specific systemic diseases much more quickly. But what happens if there is no infection at all? Well, in rare autoinflammatory diseases like familial Mediterranean fever, recurrent fevers can happen without any invading bugs whatsoever. The body's immune system basically glitches and mistakenly produces those pyrogenic cytokines, specifically one called IL-1, all on its own. But because we understand the biology behind this, modern medicine can actually treat these conditions by giving patients therapies that directly block these specific cytokines, effectively cutting the wire to the thermostat. I want to leave you with this final kind of wild thought. Medical history actually notes that even way before antibiotics ever existed, fevers from infectious diseases rarely exceeded a natural thermal ceiling of 106 degrees Fahrenheit. Our bodies seemingly produce intrinsic neuropeptides that act as central antipyretics. It's basically a built-in safety cap to prevent us from literally cooking ourselves. So, if our brain has this hidden automatic override switch just to cap our fevers, what other brilliant built-in safety mechanisms is your biology hiding from you? It really makes you appreciate the complex machine you live in every single day. Thanks so much for joining me on this explainer, and I'll catch you next time.